Good morning, my name is Michael, and today I'm going to be talking about oxygen therapy delivery devices. Oxygen therapy delivery devices are used for patients to deliver supplemental oxygen who need more oxygen than room air delivers. For example, the room air delivers 21% oxygen in the air that we breathe. The term that I'm going to use throughout this presentation is FiO2. So the FiO2 of room air is 21%. First device I'm going to talk about today is a nasal cannula. Nasal cannula is a low flow device. It flows at a 1/4 liter to 6 liters per minute for adults and a 1/4 liter to 2 liters for infants. The FiO2 range on this one is 22 to 40% and it is a variable stability. The advantages to this device is that it's easy to use, disposable, inexpensive, and you can eat while wearing it. The disadvantage to this particular device is that it can be irritating to the nasal passages for some patients, and especially at the higher flow rates, and it can be unstable and dislodged. The way that you would assist a patient having nasal dryness from this particular device is that you would use a humidification device, like a bubble humidifier. You put the bubble humidifier in line between the oxygen source and the nasal cannula itself, and it would humidify the air and hopefully relieve the patient's nasal dryness. Best uses for this particular device are patients that are stable and patients that require long-term oxygen therapy at home. The way you put this device on, you can see that there's a couple prongs where the oxygen is delivered and that they're curved. You want to make sure that the curve points down towards the lungs. I'm going to demonstrate it putting it on myself. I'm going to show you how easy it is. And you secure it by taking the tubing around the ears and use this little sliding collar up here to secure it in place. You don't want to do it too tightly because you want the patient to be comfortable, but if you do, it's too loose, then it could become dislodged and unstable. The next device I'm going to talk about today is the, in fact, before I let go on, since we were just talking about the nasal cannula and the FiO2 percentages on this device, I'd like to show you an easy way to calculate what the FiO2 the patient would be delivered using a nasal cannula. So it's called the 4% rule, and basically for every liter per minute of flow that's delivered through a nasal cannula, you can estimate that there'll be an increase of 4% to the FiO2. So with room air having an FiO2 of 21%, if you're adding 1 liter a minute per flow of supplemental oxygen, you would add 4% to that, and that would make it 25% FiO2. Just to give you another example, if you used 3 liters per minute, you would multiply that by 4, that gives you 12, add that to the room air of 21, and then you have 33% FiO2. One more for you, if you're using a liter flow of 6 liters per minute, you would multiply that by 4, that equals 24, and then you would add that to the 21% room air the patient is breathing, and then they would have an estimated FiO2 of 45%. The next device I want to talk about today is a reservoir cannula. It's very similar to the nasal cannula that delivers oxygen through the nasal tubes here. But the difference is that this one has a reservoir attached to it. The FiO2, I'm sorry, the flow, let's start with the flow rate. The flow rate for this particular device is up to 4 liters per minute. It has an FiO2 range of 22 to 35% variable stability. The advantages are similar to the nasal cannula, and that is that it's inexpensive, easy to use, and you can eat while using it. One additional advantage is that it's considered an oxygen saver or an oxygen conserver, and the reservoir helps that, makes that happen, and you can deliver a higher FiO2 at a lower flow rate. That's important for people that are at home that have their own oxygen tanks, so they don't have to change the tanks out as often. A disadvantage to this particular device, also similar to the nasal cannula, is that it can cause nasal dryness and soreness and nosebleeds. Another disadvantage is that it does have to be replaced often, more often than you would with a regular nasal cannula. Another disadvantage for this device and the nasal cannula is that If the patient is a mouth breather is somebody who breathes predominantly through their mouth. This can be for many reasons. They could have had an injury, a deviated septum to their nose, or perhaps maybe they've dealt with allergies their whole life and they've just learned to breathe through their mouth. What that does is that increases the amount of room air that the person's breathing in relation to the supplemental oxygen that's given by the device, and that lowers the FiO2. Next I want to talk about are the reservoir bag devices. So, before I move on, I'm not sure if I want to make sure everybody knows that this also is good for home patients and ambulatory patients that are looking for more mobility. First reservoir bag mask I'd like to talk about, reservoir mask I'd like to talk about is the Simple Mask. Simple Mask offers a flow rate of 5 to 10 liters per minute and 35 to 50% FiO2 with variable stability. This particular mask is also inexpensive, easy to use, and delivers a moderate FiO2. Disadvantage of this particular device is that it can be uncomfortable for some patients, especially those that are claustrophobic, that want to take it off all the time. And then there is a suffocation hazard. If somebody vomits into it, they can breathe in their own vomit and suffocate. Best uses for this are for emergency patients and for patients requiring moderate FiO2 for short terms of oxygen therapy. This particular device does not require humidification, and just for clarification, neither does the reservoir cannula. Next device I'm going to talk about is the partial rebreather. The partial rebreather is a device where the patient actually rebreathes a portion of the air that they exhale. This particular device operates at a minimum of 10 liters per minute flow and a FiO2 range of 40 to 70%, and is also considered variable stability. The advantages to this particular device is it's cheap, easy to use, and offers a moderate to high FiO2. Disadvantages to this particular device are that it can be uncomfortable again for some patients. It can be a suffocation hazard, and the person has to take it off to eat. This one also does not require humidification. The next mask I'd like to talk, if I haven't mentioned clinical uses, and if I'm repeating myself, I apologize. This is for patients who require moderate FiO2 and short-term oxygen therapy and emergency room patients. The next device I'm going to talk about today is the non-rebreather mask. A non-rebreather mask, similar to the partial non-rebreather, requires a minimum liter flow of 10 liters per minute, offers an FiO2 of 60 to 80%, and is considered a variable FiO2. This particular mask also has the advantages that it's easy to use and inexpensive, and delivers a nice high flow of FiO2 to the patient. Disadvantages, also similar to the other masks, suffocation hazard, you have to take it off to eat, and it can be uncomfortable for some patients. So let me show you how to put all these masks on. The Simple Mask, basically you would just plug this into your oxygen device, set your liter flow, place it over the patient's mouth. This one I'm actually going to put on for you and show how it's done. You'd put the mask over the patient's nose and mouth, pull the strap over their head, and secure it tightly with the straps on the side, and use the nasal clip. Not sure if you can hear me. You can use the nasal clip to tighten it up against the nose, and you get a nice good seal, therefore ensuring a better delivery of supplemental oxygen to the patient. The next two masks, the partial rebreather and the non-rebreather, have a reservoir bag on the bottom. Once you set your liter flow up to the minimum of 10 liters per minute, you would put your thumb over the device, in the device over the valve for the bag, and you let the bag inflate. If the bag doesn't inflate, you know you have a faulty device and you want to just get another one right away. If you do this and the patient is inhaling and the bag doesn't inflate quickly enough or deflates too much during inhalation, you want to up the liter flow and see if that remedies the problem. If it doesn't, you probably want to get a new device as well. And again, I hope I'm not repeating myself, but this particular device is good for emergency room patients and patients that require a high flow of FiO2. The next device I'm going to talk about today is a high flow device. High flow devices, to be considered a high flow device, it must ensure a fixed FiO2 and deliver oxygen at oxygen flow that exceeds the peak inspiratory flow of the patient. The first device I'm going to talk about is called an air entrainment mask, also known as a Venturi mask. This particular device works by using these inhalation ports to regulate the flow of air and supplemental oxygen that goes into it, ensuring a precise FiO2. The FiO2 range for this particular device is 25 to, I'm sorry, take that back. Yes, 25 to 40%, sorry, 25 to 50% FiO2, and uses flow rates at 60 liters per minute and above. The advantages for this particular device is that it is inexpensive, disposable, easy to use, and delivers a precise FiO2 to the patient. The way you'd put this together is that you would take one of these inhalation ports, which are labeled with liter flow per minute and the FiO2 percentage you're looking to deliver. Every manufacturer is different, so you can't necessarily try and memorize the color for the particular liter flow that you're trying to deliver to the patient. This one says 4 liters per minute at an FiO2 of 4%. Hard to read. Probably want to use your glasses if you need them to use it. Some are easier to read than others. In any case, what you would do is you would attach the jet intake to the mask and attach the collar around it. This collar is important because it protects the ports from being clogged from, let's say, a blanket or the person's arm or something, because it's super important that they get the amount of flow, outside airflow to mix with the supplemental oxygen coming through there to deliver the precise FiO2. Disadvantages for this particular device is it can only be used on adults, and it is quite noisy. This device also is best used in clinical situations where the patient is unstable and requires a low flow, precise FiO2. This one does not use humidification. The next device I'm going to talk about today is the oxygen blender. This is an oxygen blender, and what it does is it blends room air and oxygen together to deliver a precise FiO2. The FiO2 range of this particular device is 21 to 100%, so it's considered a full range device. 21% being the room air that we're breathing right now, and then up to 100%, and that's done by the supply of air and oxygen into these ports, and it proportions and blends it right in here themselves. This operates at a liter flow, minimum 60 liters per minute. The advantages to this particular device are that it delivers a precise high flow FiO2 or low FiO2, very precise in what you want to give to the patient. Disadvantage of this particular device is that it does require 50 PSI delivery into the device for it to work, and that sometimes it is unreliable as far as the accuracy goes, and can fail. And just to reiterate, these two particular devices, because they are high flow devices, they are fixed FiO2s. Again, that is part of being able to qualify as a high flow device, that it offers fixed FiO2. The O2 blender is good for patients who require high flow and high FiO2 requirements. The next device I want to talk about today is the pulse oximeter. This is the pulse oximeter. Pulse oximeter uses red and infrared light to detect arterial or saturation of oxygen levels in arterial blood. It also can detect the person's heart rate on here. This can actually sometimes be inaccurate. That's because the person may have fingernail polish, they may have a super dark pigmented skin, or they may be like waving their hands around and talking with their hands. What would also give a false reading on this particular device would be a person that's in shock and a person that is suffering from carbon monoxide poisoning, as this device does not distinguish between the carbon monoxide in the blood and the oxygen saturation of the blood, therefore giving a false high reading. Ways to remedy the inaccuracies are, first of all, have the person try and stay still and they're not waving their hands around. You can also move the device to a different digit, or even to an earlobe, or there are also pulse oximeters that are flat, and you can like put it right on a person's forehead, and they can read the person's oxygen saturation in the arterial blood that way. I believe I've pretty much covered everything here on the pulse oximeter. So I'd like to conclude the demonstration for everybody today. Thank you.